Session 14. Ongoing support for mothers. Step 10 of the 10 steps to successful breastfeeding states: foster the establishment of breastfeeding support groups and refer mothers to them on discharge from the hospital or clinic. This is Fatima and Mariam, as you can see them in the picture. And Fatima and Mariam are preparing to go home from the hospital with their babies. What does a mother need before she leaves the hospital to go home with her baby? Preparing mothers for discharge. Before the mother leaves the maternity facility, she needs to first be able to feed her baby, know the importance of exclusive breastfeeding for 6 months and continued breastfeeding after the introduction of complementary foods. If she is giving replacement feeding, she should know how to get the suitable milk and prepare the feed in a safe manner, and be able to recognize that feeding is going well and find out how to get the ongoing support that she needs. Fatima and Mariam meet sometimes, sit and talk about their babies, and Fatima likes to hear what Mariam has to say because this is Mariam's second child, and Fatima values Mariam's experience and knowledge. So, who in the community could provide ongoing support for a mother in feeding and caring for her baby? Potential supporters. These include family and friends, primary and community healthcare workers, mother-to-mother support. Before discharge, discuss what family support she has at home. Talk with family members about how they can provide help and support. Give the mother the name of a person to contact to arrange a follow-up check in the first week at home, to include observation of a breastfeed. Tell her about any mother support groups in her area, or the names of experienced mothers willing to support a new mother. Remind the mother of the key points about how to breastfeed. It's very important. And what are the practices that help. Be sure that the mother receives no written material. Written material about what? About breast milk substitutes, of course, and bottles, and pacifiers, and all those things that interfere with breastfeeding. We want her to exclusively breastfeed in the first 6 months. And she has to know the dangers of these other things that are promoted, unfortunately, in the market as suitable for the babies before 6 months, when they really are not suitable for those babies. Contact the mother after she has returned home to learn about how feeding is going on with her. Mothers really appreciate this sort of help and really appreciate to be contacted and to be supported in their feeding. Why is continuing to breastfeed after return to employment recommended? Reasons to continue breastfeeding are: in addition to the general benefits of breastfeeding, employed mothers and babies enjoy less illness in the baby, so mothers misses less time from work to care for her sick child. The ease of the night feeds, and so mothers don't need to get up from their sleep to prepare a feed. She can feed directly while she is sleeping. Opportunity to spend time with the baby more and to be more close to the baby. And it gives a chance to rest while she feeds the baby. So she can sit down and feed the baby, and she doesn't have to go and do housework. And with the feeding, there's a special enjoyment or euphoria that accompanies the act of feeding the baby, the personal relationship that develops, the bonding, the attachment, the eye-to-eye contact, the emotional feelings, the emotions and feelings that come with this. A special personal relationship develops with her baby. If an employer asked you why she or he should support a woman to breastfeed after she returns to employment, what could you say? Actually, there are many benefits to employers from breastfeeding. Mothers are away from the work less because their children are healthy, so she doesn't have to take leave because the child is sick. Mothers can concentrate on their work more because they have less concern about their baby's health. Employers can retain those skilled workers, those mothers who have been trained by their employers and they have skills. So they don't have to get a new employee who still needs to be trained and will cost the company a lot of money. Women are more interested in working for employers who are supportive to them in their breastfeeding and child caring experience and needs. Families and the community think well of the employers, gives them good reputation in the community, and when they are supportive to mothers. Breastfed babies grow up to be a healthy future workforce, so they can later on in life be productive, and this will improve the economy of the country as a whole. What are the key points to discuss with a mother who is preparing to return to employment? How can we protect an employed woman? Some weeks before the mother is due to go back to work, discuss with her if the baby can go to work with her. Could the baby be cared for in the nearby workplace? Could the mother work shorter hours or fewer days until the baby is older? If it is not possible to breastfeed the baby during the working day, suggest breastfeed exclusively and frequently during maternity leave. Learn to express the milk and leave it for the caregiver to give to the baby. Have contact and support from other mothers who are working and breastfeeding. Sustaining continued breastfeeding for 2 years or longer. Breastfeeding continues to provide closeness to the mother, protection from illness, and good nutrition to the older baby and young child. Until a baby is a year old, breast milk or breast milk substitutes, if not breastfed, should provide the main part of the baby's diet. So we need to exclusively breastfeed in the first 6 months, and then after 6 months we can give a diet, but it should be free of cow's milk. And the mother should continue frequent breastfeeding and giving other foods after 6 months, and give the other foods in the way that will not interfere with breastfeeding, i.e. without using bottles or teats. And we call this food complementary feeding. It has to be fed by cup and spoon and not by bottle. And recommend that the mother continue to offer the breast as frequently as possible, not to decrease the number of feeds, and also to regularly give the complementary foods 3 times a day, and to make sure this complementary food is homemade and made in a way that will not interfere with breastfeeding. Whenever she wishes to wean, she should do that safely by reducing the number of feeds, not to do it abrupt weaning, because this is very psychologically damaging for the baby. So we can reduce the number of feeds gradually and make sure that the baby takes lots of foods 5 times a day, and that the last feed we wean off is the night feed. So it is important to keep the night feed, or the feed in which the baby takes before going to sleep, whether he sleeps at night or day, to keep these feeds to the very last, to the very end of the weaning process. Other national programs for mothers and children. We have other national programs that support breastfeeding, and they are complementary to breastfeeding, and these include safe motherhood programs that drive or that aim to reduce maternal mortality. And breastfeeding plays a very important role in reducing maternal mortality by ensuring that, by encouraging, of course, the natural childbirth, vaginal birth, encouraging the first hour skin-to-skin contact, and the first breastfeeding within the first hour. And so we are reducing ensuring that the placenta is well separated and reducing postpartum hemorrhage. The IMCI again aims at reducing mortality from diarrheal disease and respiratory infections, and here breastfeeding is very important because especially exclusive breastfeeding in the first 6 months can markedly reduce mortality from diarrheal disease and respiratory infections, and plays an important role in recovery and ensuring safe recovery from any diarrheal episode when we give breast milk, and especially prevention of dehydration by breastfeeding. The EPI's expanded program of immunization is a program that aims at eradicating communicable diseases that can be prevented by vaccination, and reducing the mortality and the morbidity that happens as a result of these diseases. And breastfeeding is very important because it boosts the immunity, it boosts the immune response from the vaccine, and it helps to control it helps to control the diseases, the spread of the disease by improving the immunity of these children, and thereby reducing their susceptibility to being infected despite the vaccination. Micronutrient supplementation like iron deficiency and iodine deficiency, and again breastfeeding we know prevents iron deficiency in the first 6 months when it is exclusive, and we know that iron deficiency leads to deficits in the attention, the intelligence of the child, and intellectual ability of the child. And if we exclusively breastfeed, we are preventing the iron deficiency. Babies who are not exclusively breastfed or receive supplemental or replacement feeds are susceptible to iron deficiency, anemia, or iron deficiency as alone, and can subsequently develop intellectual deficits. Neonatal screening programs for PKU and for metabolic disorders, hypothyroidism. These programs can also have an important component in them. Breastfeeding is an important component because we know that in phenylketonuria, exclusive breastfeeding in the first weeks and months of life are very suitable for those babies because it has a very low phenylalanine content, and depending on the enzyme deficiency or the extent of the enzyme deficiency, we can gradually reduce the breast milk, increase the phenylalanine free formula which is given for them. The phenylalanine, or the low phenylec, is a very expensive milk, and it will cost the mother a great deal. If she can use her breast milk to give the baby and at the same time reduce the amount of low phenylalanine milk which is being given, then this will be very economic for the mother and for the family and for the country. And we do that by regularly screening and watching the phenylalanine, whether in the blood or in the urine. Early child development Again, breastfeeding and bonding, mother bonding, attachment of the baby to the mother is very important for safe and good development of the child. We know that family planning also promotes exclusive breastfeeding in the first 6 months because of the LAM or the lactation amenorrhea method of contraception, and even after the LAM in the later 6 months, the second year, repeated or on-demand feeding for at least 8 times with 3 times at night will be complementary to any other contraceptive device used. So in all those programs, we need to promote breastfeeding. Now we will go to a group support activity. These are role plays for problems which are presenting to a mother support group. And we will now watch a mother support group and see how they are discussing different points and how the discussion proceeds. This is a video. Knowledge check. Section 4:14. List 3 sources of support for mothers in your community. Well, the first source of support should be the hospital or the primary healthcare unit, the extended family members, and the NGOs, or the mother support group leaders that are trained by NGOs. Give 2 reasons why mother-to-mother support may be useful to mothers. I think from the video you have seen how it is useful. Why? Because mothers to mother, they speak the same language, they have the same experiences, they know how to convince each other, and they are very helpful to one another in many ways. Give 2 reasons why breastfeeding is important to an older baby and the mother. Breastfeeding or tandem feeding, feeding of the older baby will increase the bonding with the other baby and prevent psychological disorders that can happen between them. The economics of breastfeeding promotion, how to advocate for breastfeeding support systems and for families and members. Budgetary allocations for breastfeeding support system for mothers and families are inadequate, although breastfeeding is an economic source to nations and families. How? Economic impact of health consequences of breastfeeding support significantly reduced doctors' visits and hospitalizations during the first 18 months of life in a study conducted with Hong Kong Chinese infants. Follow-up of a population-based cohort of 8,327 infants for 18 months showed that the main outcome measures, utilization of outpatient visits and hospitalizations for jaundice, gastrointestinal illness, or respiratory febrile illness, and all illnesses. Breastfed infants had fewer illness-related doctor visits overall through the first 18 months of life. Results were strongest for infants breastfed exclusively for 2 to 3 months. Hospital system costs of artificial infant feeding 1 to 2 million per year for 5 illnesses, and the costs are minimum estimates of the cost of early weaning, as they exclude numerous of other chronic or common illnesses and out-of-hospital healthcare costs. Higher rates of exclusive breastfeeding would reduce these costs. Interventions to protect and support breastfeeding are likely to be cost-effective for the public system. The cost of not breastfeeding, extra 1 billion of healthcare costs each year. Infant diarrhea and non-breastfed infant costs 291 million. Respiratory syncytial virus 225 million. Insulin-dependent diabetes from 9.6 to 124.8 million. and otitis media 660 million. Thus, these 4 medical diagnoses alone create over 1 billion of extra healthcare costs each year. Breastfeeding also helps to enhance the intellectual development of children, according to at least one medical research study. The potential societal benefits of more intelligent children is incalculable, even though it cannot be directly measured in the terms of dollars. Federal funds, and what about UAE? In the US, an additional $2 million in federal funds are needed. 2.5 million actually of federal funds are needed yearly in order to cover the costs of the WIC program, which provides infant formula to breastfeeding mothers. For average family, the cost of purchasing formula is twice the cost of supplemental foods for the breastfeeding mother. So, increase in breastfeeding from 17% to 50% would save up to $140,000 annually. Breastfed infants have fewer inpatient admissions. Their average total medical costs were $200 less than those who are bottle fed. An increase in breastfeeding from the current rate of 17% to the healthy people goal of 50% would save up to $140,000 annually. For each 1,000 infants never breastfed, there is an excess of 2,000 office visits, 200 days of hospitalization, and 600 prescriptions, compared with infants breastfed exclusively for 3 months. These are costs and savings for health facilities from breastfeeding promotion. A hospital in Honduras with approximately 12,000 deliveries instituted intensive breastfeeding promotion program, rooming in all the babies, and resulted in major savings of $8,500, $7,500 for bottles, $1,500 for glucose solutions, $1,000 for oxytocin, and overall it saved $6,500 annually. This is a big sum if we compare it to our hospitals. Cost savings realized through intensified rooming in program in Indonesia, and their annual deliveries were about 3,000 to 3,500, and this was before rooming in. And after rooming in, we see that the monthly formula purchase and the monthly intravenous fluids purchased decreased substantially after rooming in, from 106 to 26 and from 136 to 74. Average length of stay of a newborn in the hospital also decreased from 3.2 days to 1.8 days after rooming in. So there was definitely a reduction in the hospital transmitted infection and the cross infection that happened, and definitely in the health of these babies and the cost of having a sick baby in the hospital. And this is the cost savings due to breastfeeding promotion activities in the hospital in Panama City. And in 1982, they were not implementing baby friendly. In 1985, when they started implementing breastfeeding promotion in their hospital, there was a $2 per bottle reduction in the costs, total $13,000 over the 4 years. These cost savings of rooming in compared to separate recovery rooms in the clinical hospital in Kyle and in Chile, and you can see there's so much reduction of full-time nurses, personnel cost per patient per day, and personal capital per day. And what are the costs and savings for families from breastfeeding promotion? Here you see the mother's diet and the breast milk substitutes. So mother diet costs only $50 to $100, while getting breast milks and preparation costs $300. So if mother breastfeeds, she can save all this amount and get clothes for herself, things for her, more food for her household, or even educate her children. And this is again cost of breastfeeding versus feeding breast milk substitute in France. So even in France, you get the mother's diet costs $160, while getting breast milk substitutes cost even more, $1,000, almost $1,000. At the national level, breastfeeding promotion can also save a lot. The illnesses among breastfeeding and formula feeding infants of mothers working in 2 corporations in the US. And here you see the breastfed babies and mothers of breastfed, it was 58% illnesses, while in formula fed, the illness rate for working mothers was 90%. And this reflected in absenteeism by feeding practice, and you can see the days of absentees are markedly increased in the formula fed in the blue columns compared to the much lower ones of the breastfed in the yellow columns. The value of breast milk to the national economy in India. National production of breast milk by all mothers in India for children that were breastfeeding at the time of the estimate was around 4,000 million liters over 2 years. So if breast milk produced were replaced by tinned milk, it would cost 118 billion rupees. If imported, the breast milk substitute would cost even $4.7 million US. If breastfeeding practices were optimal, breast milk production would be twice the current amount, doubling the savings by fully utilizing this national resource. And again, these are savings from 3 childhood illnesses, from otitis media, gastroenteritis, and necrotizing enterocolitis. And these are the costs that are including only the surgical and the non-surgical treatment. Here only the physician visits and the hospitalization, and here the surgical treatment. So it doesn't include the costs to the family. It doesn't include the medical treatment costs. It just includes these are the costs that are included. So it's a sort of an underestimation of what the cost is. But they came up with quite a big figure. This is a 9-digit figure, and here they came up with a 7-digit figure, and here they came up again with a 10-digit figure from necrotizing, and so it all added up to $3.6 billion or over. Savings from potential increases in exclusive breastfeeding in England and Wales. It has been estimated that the National Health Service spends around $35 million per year in treating gastroenteritis in bottle-fed infants. For each 1% increase in breastfeeding at 13 weeks, a savings of 500,000 sterling would incur from the treatment of gastroenteritis. In conclusion, breastfeeding is the most efficient cost-saving strategy for hospitals and communities at large. Breastfeeding and breast milk can save lives, reduce the impact of illness on the suffering of families, and direct and indirect costs involved. Inadequate hospital practices and company-guided promotion of formula milk by the health teams continues to be an impediment to breastfeeding success rates. And we hope and we recommend that governments and other donor agencies invest more in the promotion and support and protection of breastfeeding, and that legislative measures be done to control the market and marketing of alleged substitutes of breast milk and breastfeeding, and strongly advocate the economic and health related benefits of breastfeeding. Thank you very much.